Hi, today we'll be talking about the rationalization of your a section of your module with serial P of House Bolton-332. Number 41. A nurse working in the triage area of an emergency department sees several pediatric clients arrive. eliminated because this is really what contraindicated, because when you visualize, which means you will insert the scope on a client who has epiglottiditis, if you elicit the gag reflex, okay, remember that a client who has epiglottiditis should have you should never elicit the gag reflex because it can cause airway obstruction. Therefore, eliminate B. But best answer is Dallas. Next, number 47. A student nurse working with a registered nurse is assessing a child with epiglottiditis. The student tells the client she needs to look at his throat. Which of the following intervention by a registered nurse is best? So it says here that the student will check or assess the throat of the client. What should be the intervention of the nurse? A. Hand her a flashlight and tongue blade. B. Give her a sterile tongue blade and a pulsurette swab. C. Tell the student that the registered nurse will visualize the child's throat. Or D. Tell the student the visualization will be done by anesthesiologist. So first, let's try to eliminate A and B because, like I said, this is what contraindicated. You cannot insert anything into the mouth because it can elicit gag reflex, and gag reflex can cause airway obstruction. Between C and D, Dallas is the answer. You can only, or the only person who can visualize the client's mouth is the anesthesiologist or a trained physician, okay, a trained physician. So the student cannot insert or visualize the epiglottiditis. That is the answer. Number 48. The mother of a 2-year-old child with epiglottiditis says she needs to pick up her child from school. 2-year-old child begins to cry and appears more stridorous. So, which of the following intervention by the nurse is best? Ask a mother how long she may be gone. B. Tell the 2-year-old everything will be alright. C. Tell the 2-year-old nurse will stay with him. Or D. Ask the mother if there's anyone else who can meet the other or the older child. So remember in this situation that the 2-year-old child will have more stridor if he cries. Okay, 2-year-old child who if he or she cries, the more stridorous. And remember in the concept of your psychology or in your pediatric developmental stages, a 2-year-old has what you call your separation anxiety. Now, if the mother leaves, of course, the child will cry, and like I said, if the client cries, the more stridorous. Therefore, the best answer here would be Dallas. Ask if someone else can meet the child. You assess first if there are alternative to the part wherein the mother will fetch the older child. Now you need to try to find other alternative to this. Okay, so if there's really no choice, then you may choose another answer. But the most appropriate way here is to try to find first someone else that can fetch this older child, because the mother cannot leave the child because based on the situation and based on the developmental milestones of your pediatric nursing, a 2-year-old child has separation anxiety, and if there's anxiety, the client may cry, and it may increase stridor. The answer there is next, number 49. The father arrives in the busy emergency department and is upset with his wife for bringing their 2-year-old child with epiglottiditis in for treatment. Which of the following intervention by the nurse is best? A. Leave the room. B. Call the security. C. Recognize the father's behavior as his attempt to cope with the situation. While D. Tell both parents to leave because they're upsetting the child. Now remember that every person have different ways of reacting to situation. Okay? Again, every person have different ways of reacting to a situation. Reaction may cause anxiety, anger, sad, etc. Now, in this situation, the father is upset, and the question here is what's the nurse best intervention? Now, Since knowing the fact that every person have different way of reacting, the best answer should be letter C. You recognize that this behavior is his attempt to cope up with the situation. This is the best answer because every time you deal with clients, you need to understand their behavior first. You do not confront them. You do not tell them derogatory things. Okay, and you do not discipline them right away. You need to recognize first their feelings. That's why letter C is the best answer. Calling the security will further agitate your client. Leave the room is like neglecting the client. Okay, and letter D is tell both parents they should leave, which is not a good thing to do. It's derogatory and demeaning and discriminating. Next, number 50. 40-year-old man is being treated for GI bleeding. On his fifth day of visualization, he begins to have tremors. He, be, he is agitated and is experiencing hallucination. So the nurse already, or the situation already telling you that there is already hallucination. These signs suggest which of the following. Best answer, letter A. Alcohol withdrawal syndrome. While letter B's allergic response can be manifested by difficulty breathing, um, itchiness, and so on and so forth. Hypoxia, eliminate that because there should be what? Cyanosis. So these are the manifestation of hypoxia. And of course, Alzheimer's should be have what? Should have manifested as memory problems. So eliminate C. Best answer is letter A. All the mentioned um, sign and symptom like tremor, agitated, hallucination are they're all support alcohol withdrawal. Next, number 51. If a nurse suspects a client is experiencing alcohol withdrawal syndrome, which of the following action is appropriate? A. Verify it with the family. B. Inform social services. C. Ask the client about his drinking. Or D. Tell the client everything will be alright. So going back to the situation, it says here you are only suspecting a client is experiencing alcohol withdrawal. So you're not sure if the client is a drinker or not because you only suspect. Because if you already know that the client is a drinker, they should not have used the word suspect. Okay, you should all know already that these are alcohol withdrawal syndrome. Now, since it's only they use the word suspect, which means it's not yet sure. The nurse is still gathering the information. The best way to verify this is to ask the client himself. That's why the answer is letter C. If the client cannot cooperate, then that's the time you answer family. But since there are no other details mentioned, best source of data should be the client. Letter C is the best answer. Next, number 52. A client experiencing alcohol withdrawal syndrome says he sees cockroaches on the ceiling. Which of the following responses is appropriate? Now, letter A. Ask the client where he sees them. B. Ask the client if the cockroaches are still there. C. Tell the client there are no cockroaches on the ceiling. And D. Tell the client to dim the room and turn on the overhead lights. So now going back, the client's experiencing the situation already mentioned that the client is experiencing alcohol withdrawal syndrome. Now, we can now say that the cockroaches are just hallucination. So it's not true. Now, if there is hallucination, what do we do? Number one, you need to assess first. You need to perform your assessment. After assessing that there is no cockroach, then that's the time present. You need to present reality. Okay. Now going to the situation, ask the client where he sees them is not an assessment because you do not need to ask the client. Just merely looking up, you can verify if there are cockroaches or not. Now, if you ask the client where he sees them, it's like you're supporting the hallucination. B. Ask the client if the cockroaches are still there, eliminate because, like I said, A and B will want is supporting the hallucination of about cockroaches. Between C and D, the best answer here is Dallas. Turning on the overhead light will what? Decrease episodes of hallucination. So this will be your goal. Letter C, tell the client there are no cockroaches is eliminated because this is what? This is improper. Okay? This is an improper way of what? Presenting reality. That's not the way to present reality. So eliminate that. The best answer here is Dallas. Next, number 53. A client is experiencing alcohol withdrawal syndrome, says he's itching everywhere from the bugs on his bed. Which of the following response is appropriate? A. Examine the client's skin. B. Ask what kind of bug he thinks they are. C. Tell the client there are no bugs on his bed. D. Tell the client he's having tactile hallucination. So again, the situation already said that client is experiencing alcohol withdrawal syndrome and itching everywhere about and relating it to the bug. So again, this is a case of what? Hallucination. And what do we do with hallucination? Number one, we what? We assess first. The first best answer is letter A. Examine the skin. After examining the skin and you see that there are no bugs or there are no any alteration in the skin. Number two, that's the time you present reality. You present reality. Therefore, A is the answer. Asking what the kind of bugs they think there will support hallucination. Telling the client there are no bugs is not improper way of presenting reality. Tell the client he's having tactile stimulation is not appropriate. A is the best answer. Number 54. Client with alcohol withdrawal syndrome is pulling his central venous catheter, saying he's swatting spiders crawling over him. Now, which of the following intervention is most appropriate? A. Encourage the client to rest. B. Protect the client from harm. C. Tell the client there are no spiders. Or D. Tell the client he's pulling the IV tubing. Now, telling the client there are no spiders and telling the client that he's pulling the IV tubing, eliminated. Why? This will not, or this may not stop the client from pulling the tube. Remember, why is it important for the client not to pull the tube? Remember that it is a central catheter. If it is pulled, the client may experience what? Air embolism. Therefore, the best answer is letter B. You protect the client from harm. Encouraging the client to rest is not appropriate at this time. Best answer is Boston. Next, number 55. Client who is experiencing alcohol withdrawal syndrome is no longer having hallucinations or tremors and says he would like to enter a rehabilitation facility to stop drinking. Which of the following intervention is appropriate? A. Ask about insurance. Obviously, that's wrong. B. Tell him he should talk with his family. That is wrong because you cannot pass the client to any other. You're the nurse, you should know what to do. Between C and D, Dallas is the best answer. Why? Because the client says he would like to enter, the clients like to enter rehabilitation facility. So the client is now showing interest to change this habit of drinking. That's therefore the nurse should focus on promoting participation because liking is first thing, but once you undergo the treatment or the uh, rehabilitation, people sometimes quit. Therefore, the focus now of the nurse is to promote participation. Next, number 56. 72-year-old man with cirrhosis is admitted to the hospital in hepatic coma. Which of the following nursing intervention has priority? A. Perform a neurologic check. B. Complete the client admission. C. Orient the client to his environment. D. Check every breathing and circulation. First, let's eliminate C. You cannot orient the client because the client is in a coma state, which makes letter C wrong. Completing a client admission is not, of course, your priority. A client in coma is considered unconscious, and a client who is unconscious, our always priority is patent array. Therefore, answer should be Dallas. Next, number 57. A client with cirrhosis is restless and at times tries to climb out of the bed. Which of the following intervention is best to promote safety? So in this situation, we're trying to find options that will promote safer decline. A. Leather restraint. B. Wrist restraint. C. Use of a vest. Or D. Use of a sheet tied across the client's chest. First, let's eliminate D because if you tie a sheet across the chest, it may what? It may decrease lung expansion. So it's not safe for the client. So eliminate D. Leather restraint eliminate because this is used only for clients who are extremely combative. Between B and C, we need to go back to the situation wherein the situation says the client tries to climb out. Between B and C, a type of restraint that will not allow the client to even move in a sitting position is letter C, vest restraint. In wrist restraint, the client can still move in an upright position. The client can still sit in the bed. Therefore, there's a chance um, of falling still in letter B. That's why the best option to promote safety is using a vest restraint. C is the answer. Next, number 58. Which of the following assessment finding in a client with cirrhosis indicates late stage symptom? Constipation and diarrhea, hypoxia, or vomiting. Eliminate these two because these are not sign and symptom of hepatic of cirrhosis. Between C and D, answer would be letter C, hypoxia. In a client who have cirrhosis in the late stage, client is expected to be what? Very weak already. And a weak client will have what? Decreased lung expansion. And if there's decreased lung expansion, client is prone to what? Hypoxia. Next, 59. A client with cirrhosis is jaundice and edematous. So there's jaundice and there's edema. He's experiencing severe itchiness and dryness. Which of the following intervention is best to help the client? A. Put mitts on his hands. Possible. B. Use alcohol-free body lotion. C. Lubricate the skin with baby oil. Or D. Wash the skin with soap. Eliminate that because soap can what? Cause further dryness. While baby oil is eliminated because the skin may turn oily. Between A and B, the best answer is letter B. Alcohol-free lotion. This will what? Moisturize the skin. And since it's not alcohol-based, it will not cause dryness. Next, number 60. A 20-year-old client with a spinal cord injury sustained previous motorcycle accident was hospitalized for renal calculi or kidney stones. To reduce the risk for developing recurrent kidney stones, which of the following instruction is correct? A. Eat yogurt. B. Cranberry juice. C. Eat more fresh fruit and vegetable. Or D. Increase the intake of dairy product. Now, the issue here is you want to reduce the risk of developing kidney stone. If we talk about kidney stone is on higher percentage for occurring in an alkaline environment, which means you need to acidify the urine so that kidney stone is prevented. Going back to the options, Boston is the answer because this is the only one that will acidify the urine. Now remember, A and letter D are both high in calcium. Therefore, this calcium can cause what? Kidney stone formation. Letter C, fresh fruit and vegetables are not advisable because they promote what? Alkalinity of your urine. Therefore, the best answer is Boston. It will acidify the urine. Acidity, less stone formation. So that ends your section House Bolton. Looking forward to the next section. I hope you get high on your scores. Thank you and goodbye.